Malaria is a potentially life-threatening disease caused by the Plasmodium parasite, which is transmitted to humans through the bites of infected mosquitoes. It is most commonly found in tropical and subtropical regions of the world, particularly in sub-Saharan Africa, but also in Asia and Latin America. Symptoms of malaria can include fever, headache, chills, muscle pain, and fatigue. In severe cases, it can lead to organ failure and death. Malaria is a major public health problem, particularly in developing countries, and efforts to control the disease have included the use of insecticide-treated bed nets, indoor residual spraying, and the distribution of anti-malarial drugs. Prevention of malaria involves measures such as avoiding mosquito bites by using insect repellent, wearing protective clothing, and sleeping under mosquito nets. Treatment of malaria typically involves a combination of anti-malarial drugs, depending on the severity of the infection and the type of Plasmodium parasite involved. Early diagnosis and treatment are critical for preventing severe complications and death. According to the World Health Organization, WHO, there were an estimated 229 million cases of malaria worldwide in 2019, with 94% of these cases occurring in the African region. The global number of malaria cases has remained relatively stable in recent years, with slight fluctuations from year to year. Malaria is a major cause of death, particularly in sub-Saharan Africa, where an estimated 409,000 people died from the disease in 2019. Children under the age of 5 are particularly vulnerable, accounting for an estimated 67% of all malaria deaths worldwide in 2019. While progress has been made in reducing the global burden of malaria over the past decade, there is still a long way to go in achieving the WHO's goal of a 90% reduction in malaria incidence and mortality by 2030. Ongoing efforts to control and eliminate the disease include the development of new tools and strategies, as well as the continued scale-up of existing interventions. There are ongoing efforts by scientists and public health organizations around the world to control and eliminate malaria. Some of the key strategies being pursued include development of new tools and strategies. Scientists are working to develop new vaccines, drugs, and insecticides to help prevent and treat malaria, as well as new methods for controlling mosquito populations. Improved diagnosis and treatment. Improved diagnostic tests and more effective treatments are being developed and implemented to ensure that people with malaria receive prompt and effective care. Vector control. Efforts to control mosquito populations and reduce the spread of malaria include the use of insecticide-treated bed nets, indoor residual spraying, and other mosquito control measures. Community engagement. Community engagement and education programs are being used to raise awareness about malaria and promote prevention and control efforts at the local level. Surveillance and monitoring. Robust surveillance and monitoring systems are essential for tracking the spread of malaria and evaluating the effectiveness of control and elimination efforts. Overall, a multifaceted approach is necessary to combat malaria, and ongoing collaboration between researchers, public health agencies, and communities is critical for success.